دكتور رمزية محمد عبدالوهاب، طبيب مقيم قلب وعيادة دموية مستشفى أبير عام الإسكندرية، وزارة الصحة، وخريج برنامج جامعة هارفارد للأبحاث الإكلينيكية ECSRT، و Associate Alumni of Harvard Medical School. Here is my contact info for more if you need any questions. I will talk today, dear colleagues. First of all, I would like to thank our mentor, Dr. Mona, for her great effort for this course. And also, much thanks for our dear mentors, Dr. Rami Omar, Dr. Muhammad Abdelwahab, Dr. Muhammad Ghalib, Dr. Maha Hassan. First of all, I will talk about debriefing and constructive feedback. What we will
Dear colleagues, our topic today is debriefing and constructive feedback. Here is what we will talk about: objectives, introduction, definition of feedback, benefits of constructive feedback, what is debriefing, and benefits of debriefing. Our objectives is what are the difference between debriefing and feedback, and how to perform a constructive feedback. Introduction. Adult teaching is not easy, so it has to be more interactive with the students and learning objectives through what is called student-centered model, and how to perform a student-centered model by facilitating and promoting the concept of ownership and self-reflection. Formal evaluation is an important event for both the student and preceptor. Yet this process often has a lasting impact on the student's development, both professionally and clinically. How to evaluate your own work, how to evaluate your peers' work, how you're meant to evaluate your work. Your feedbacks matter. Feedback should be timely, best is immediately following a task, constructive, encourage and support learning, objective and accurate, specific and relevant to the task or situation. Constructive feedback, the effect of having positive feedback. Here is it. Here is your response when you get a feedback of great work. Wow. Others has another response. And here is it. Don't panic. Always remember, anyone can't wait to listen to your feedback, even if he pretends not. So, the benefit of constructive feedback is enhance learning, corrects, modify, or improve the performance, and is conveyed through supportive language. So let's move to our next topic today, debriefing. Debriefing is one of the activities that we do in a Cardiac Academy Mentorship TTT program. When we present a case scenario, then we do what's called scenario briefing. We evaluate it and evaluate our plans and an examination and evaluate the whole case. Then we do what's called scenario observation, and everyone, the learner and participant, mention their observations. Then we do what's called debriefing, and through debriefing we conclude the case scenario. So debriefing sessions are generally characterized as informal and interactive opportunities that offer, collect feedback, exchange knowledge and understanding with partnership. Also, debriefing is most specifically to healthcare worker. Why? Because it is also utilized as a follow-up to a performance to assess whether the clinical objectives have been met and to address accountability in performance. It's also a process whereby the healthcare team re-examines the clinical accounts to foster the development of clinical reasoning, critical thinking, judgment skills, and communication through a reflective learning process. Let me say an example from our daily life. When we have a case, for example, pericarditis in our CCU, and we have discussed it and evaluated our plans and our examination and our treatment for this case. Then we got another case of pericarditis the next month, and through our debriefing of the last case, we do and follow our performance in the new case, do our skills is improved or not. Do our performance as a whole in this case, is it improved or not? So it is the importance of debriefing. So debriefing sessions evaluate performance, not performer. To sum up what we have said today, difference between debriefing and feedback. Feedback compares learner performance with clinical standard and acceptable standard. Performance is acceptable or not. While debriefing, students consider the approach, reaction, and outcome. Performance and actions are within a range of acceptable scope. I hope I can declare it well. Can I get your feedback on this? Let's go practice. And here is a link of our debriefing for our sessions for the upcoming case scenario and role play. Then you will do it practically, so keep focused. Once you click on this link, a page that will appear to you under the title of Egyptian Society of Cardiology, Cardiac Academy TTT Debriefing at Cardio Egypt 2021. When you scroll down, the first thing that will appear to you your email address, your name, case topic, and case. Is it curricular case, student case, or others? Let me explain what's the difference between curricular case and student case. Student case is a case that the students have prepared from A to Z and have done on it questions and answer and gathered the guidelines to it and discussed it in the class. While curricular case is a case that mentor has sent it to the student and the student prepare a presentation PowerPoint to this case and discussed it in the class. So you have to fill all these items as it is all required. Then you click on next and another page that will appear to you under the title of Professionalism for Habit Model. And here is your evaluate the role play. The person has done the doctor role and the other who have done the patient and other who have done the case analyzer. And here you evaluate their own performance. And in professionalism, we will evaluate the doctor play. Is it invested in the beginning? Does the doctor warmly greeted the patient, displayed familiarity with the patient, primarily used open question, encouraged the patient to tell their story, covered patient concern, or others? You can click one of them or all of them as you wish. Then, elicited the patient perspective. Does the doctor ask it about the patient understanding of the problem? Does the doctor listen to the patient concern? Identified patient goals for the visit? Displayed interest in how the problem is having an impact on the patient life? Or others? Demonstrated empathy. Does the doctor demonstrate empathy? Does the doctor encourage the patient expression of emotion? Help the patient label and identify their feelings? Accepted and validated the patient feelings, displayed effective nonverbal behavior for others, invested in the end. Does the doctor avoid the use of jargon? Jargon is the medical terms. Does the doctor offer the information about that matched patient's perspective? Does the doctor explain the reasoning behind test procedure or medication? Tested the patient comprehension, explored the acceptability of the treatment plan, explored barrier, if any, to the plan, made plans for follow-up, encouraged questions, others, then you click on next. Another page that will appear to you under the title of evaluation. Here is your evaluate the case scenario as a whole. Does these items are covered or not? And here is a range from 1 to 5. 1 is not covered, 5 is fully covered. First of these items is the present history. Is it covered or not? Past and family history, is it covered or not? Complaint, covered or not? History of present illness, risk factors, other body system, general examination, local cardiac examination, all of this is covered or not? Investigations, covered or not? Fully differential diagnosis, covered or not? Treatment, is it covered or not? Patient counseling, is it covered or not? And all of them are ranged from 1 to 5, and all of them are required. You have to fill it. Then you analyze the case analysis, the case analyzer. Is this person at the educator level, understands the science above expectation level, proficient, meets expectations, emerging average understanding of the science, beginner poorly understands the science? Is there any missed data or analysis? A team excellent at, and you mention what you have seen. A team needs to improve, needs to work on improving at, for example, presentation skills, knowledge, whatever you have seen the team has defect in it. Then if you have any comment for individual team members, you have to mention it. Then you click on submit. Congratulations, your response has been recorded. Your debriefing is done. Is there any question? Thank you.